In today's video, I'm going to be sharing my favorite exercises that I use with my patients to overcome lightning crotch pain or pain around your pubic bone, also known as Pubic Symphysis Dysfunction or SPD for short. This is really common during pregnancy, and one of the biggest drivers as to why this occurs is usually due to a muscle imbalance on the right versus the left half of the pelvis that creates this kind of torsion or rotation of the pelvic bones that increases excessive load and irritation around the pubic bone region. So the best way to address this is by strengthening these muscles more uniformly around the pelvis, which is what we're going to be doing in today's series. Things to have on hand, you want to have some yoga blocks or a ball or a kind of towel roll for support if you don't have blocks. And then I'm going to also be using a 10-pound dumbbell. So have something around that for you. If you don't have a dumbbell, you can still follow along without a weight, but just to give you an idea of what to have around. So I'm going to move this out of the way. We're going to begin actually in a stretch for our inner thigh muscles first. So I like to often support my body here. Feet are going to come into sort of a butterfly position. If you can open your knees here and feel that really big comfortable stretch into your inner thighs and feel relaxed here, you can stay unsupported. Often though, I find that many of my patients will feel one side in particular that feels especially tight. So in that case, you want to use a prop. This can be a yoga block or a pillow or some type of bolster underneath your legs at the height that allows you to comfortably relax into this stretch. Once you're there, we're going to invite breathing in this position for approximately 2 minutes. I also recommend if it feels difficult to keep your body upright like I am here, you can absolutely lean back against a piece of furniture, a wall, something supportive so that you don't have to actively hold your body here if this is too challenging for you as well. So as we're here, another really helpful, important point around reducing pain and discomfort around the pubic bone also relates to our breath. So as we're here, I want to invite you to really think about your breathing around your rib cage and inviting more of those longer, deep inhales to expand your rib cage east and west. That is going to create more lengthening and relaxation down through the pelvic floor, which also helps to reduce any excessive pull or strain on the pubic bone from the inside, because our pelvic floor is also inserting on the pelvis right on the inside of the pubic bone. So pelvic floor tension can also contribute to pain in this area, in addition to how the inner thigh muscle is attaching on the rim here of the pelvis. And that is what is creating this tug of war often on the pubic bone itself. So by stretching here first and opening up the inner thighs, that's always my first recommendation with my patients. That also helps to give insight into if one side is especially tight compared to the other, noticing what side might need a little bit more stretching and love in this way. And by starting here, then we're going to add strengthening into it afterwards. So from here, we're going to transition onto our back. If you need more time to transition due to discomfort with your pubic bone pain, please pause the video as I go into each exercise as needed and move at the pace that feels most comfortable for you. Also note here, as we come out of the stretch, I often recommend taking both hands and assisting your legs back together. And then as you transition, keep your legs hugged and close together to reduce any excessive pain and discomfort on your pubic bone as well. So I like to kind of shift in this way and then slowly walk myself down onto my back. Then we're going to take our block here and I am going to just keep it off to the side. We're going to use it for the next exercise. From here, we're going to start with our marches. So I'm going to ground my pelvis flat into the mat. My left leg is going to stay grounded, tripod, big toe, pinky toe to heel. And I'm going to start to gradually pull that foot back towards my pelvis to activate my left hamstring. That's going to help stabilize my pelvis while I move my right leg. From here, I'm going to inhale to prepare. Exhale. Start from the lower abdominals, zip upward as I march my right leg up to tabletop. Hold it here as I inhale, and then exhale, again, activate through my abdominal muscles. Keep that activation as I slowly set my right leg down. Inhale here at the bottom, exhale. Find that zip. Keep the back of your pelvis level throughout the entire movement. And then inhale at the top, exhale to slowly lower it back down. As I move continuously with this leg, my left leg is still holding on to that active hamstring pull. So my left foot is not moving, but is creating energy of that pull towards my pelvis as I am marching my opposite leg. Our hamstrings do a lot to help stabilize the pelvis and also to reduce that torsion that I was mentioning earlier that often contributes to pubic symphysis pain. One more here. Exhale to lower it down. Now we're gonna switch sides. So my right foot is going to ground into the floor and then create that pull back towards my pelvis so I can feel my right hamstring activated. Now I'm gonna inhale to prepare, exhale, hug baby and draw that leg up. Inhale here at the top, exhale, hug baby, to lower back down. Keep going in this way, using your breath, exhaling to lift. Keep that right hamstring activated, and then exhale to slowly lower it down. Inhale at the bottom, exhale. Moving through a range that feels comfortable for you. If you notice that coming up into this full march is causing too much discomfort around your pubic bone, alter it and just move through the range that feels available for you right now. And as you build more strength, then you can move into those larger ranges if needed. Also note that this stationary leg, make sure that that knee is not drifting out to try to stabilize for you. We want it to stay parallel with the rest of the body and your foot. Last one here. Inhale to prepare, exhale to march. Inhale, exhale again to lower it down. From here, you're gonna reach for that yoga block or your ball or towel roll. I'm gonna place it between my knees, and I want you to create a 50% effort of a hug around that yoga block. If that amount of energy into the block creates more discomfort around your pubic bone, then find whatever amount of press helps to ground around the block without causing more pain. And then over time, you can work up to that 50% effort. My feet here, I want them to be grounded to the floor, big toe, pinky toe to heel on both sides. And now we're gonna go into our bridges. So you're gonna take a deep breath in to prepare. Exhale, gently tuck the pelvic bone underneath. And then you're gonna slowly press up into your bridge. Hold here, really feel your glutes activate. Also feeling our inner thighs, creating that support around the block. And then you're gonna inhale as you slowly lower back down, bringing your body all the way to the floor. Rest for a brief moment and then reconnect. So we inhale here, exhale. We are hugging baby, hugging the block, gently tipping the pelvis and rolling up into your bridge, finding that glute connection. Maintain that hug around the block as you inhale and slowly lower back down. As you keep moving in this way, I want you to really notice and make sure that you're pressing up through your glutes and not arching with your back to lift your body. So make sure that your rib cage stays grounded and that we're keeping a nice long spine and moving our body up from the pelvis, not from our back. Last one, lifting. Grounding equally into both feet, just lifting up as high as you can really feel that work into your glutes, and then lowering down. From here, we're gonna roll onto our side, and I actually like to keep the block here. As I shift my weight, hug that block as you roll to your side to give you some support around your pubic bone. From here, we're gonna come with the yoga block underneath your back leg. You're bending that knee at about a 90-degree angle, and you have your other leg in front at that 90-degree angle. I have my elbow then directly underneath my shoulder. And from here, I want you to really think about pressing up out of your elbow here to connect through your side body, so our obliques and our lats, which also work directly with our inner thigh to create support across the pelvis. So training these muscles also helps to reduce excessive strain across the pubic bone. So here, we're gonna press this top leg down into the block to start to feel some activation into our top inner thigh, or in this case, my left leg. Then on our next motion, we are going to keep that pressure activated, keep the grounding of my elbow as I then exhale, and I'm gonna float this bottom knee up off of the floor. I'm gonna hold here for a moment and then inhale to lower that leg down and relax the rest of my tension in my body. So again, we press into the block, we inhale to prepare, exhale, hug baby, as you float that knee a couple inches off the floor. As you do that, you should feel how your obliques and your lats really have to kick on, as well as how that increases inner thigh work of both legs. Inhale to lower that leg and reduce the effort in your body. Once again, exhale to press, hug baby as you float that leg up. Make sure that you don't roll back in order to get this leg up. That's a very common pattern. So just lift that leg up as high as you can, feeling that activation in both legs. Release and relax. Keep going in this way, activating, pressing into that block, moving that leg up through the ranges that feel most comfortable for you. And know that over time, as you get stronger, more range will often be gained. Let's go ahead and switch sides. So once again, for your setup, you're gonna take your block or your towel roll, place it underneath that top knee, 90-degree angle on the front leg, 90-degree angle on the back leg. I'm gonna press up out of the floor with my left arm this time. And now I'm going to activate my top leg into the block. Inhale to prepare, exhale starting from your lower abdominals upward as you float that bottom knee up. And then inhale to slowly float that leg down and relax the rest of the tension that you generated in your body. Once again, inhale to prepare, exhale to press, hug baby, and float the leg up. Hold here, making sure that we aren't twisting or leaning back in order to do that. Float that leg down with your inhale, relax the tension that you were holding in this top leg. Once again, press, exhale, hug baby. Really think about those two front hip bones wrapping towards each other as you lift up through the rest of your abdominal muscles. And then slowly lower that knee down with your inhale and relax. One more here, press, float that leg up, hold there for that minute. Slowly release. And now we're gonna move on to the next exercise where we're gonna be on hands and knees. So for this part, you're gonna want that weight that I mentioned. I'm gonna use the block between my two legs. So the block is going to be, you can go long ways if that feels more comfortable, or you can go in a more narrow stance. Choose what feels most comfortable for you. I want you to be able to just use that block to create a hug with your inner thighs for this particular exercise. So from here, you're gonna create a tabletop position here with your body. You're gonna hug that yoga block with about 50% effort. From here, we're gonna inhale to prepare, exhale, hug baby as you pull up into that row. Hold that there for a moment and then inhale to release back down to the mat. Keep that hug around the block continuously. Again, as you inhale to prepare, exhale to pull. As you pull, be thoughtful that you're not shrugging your shoulders up. Keep that elbow close to your rib cage. We don't want it winging out or fanning out. So pull, feel that work between your shoulder blades and your lats, and then release all the way back down. Keep breathing in this way as I point out a few other things. So as you pull back, really notice if your body tries to shift. We want to keep midline from moving as we move our arm. Also, our lats in this case, which are the big muscles on the back of our rib cage, connect to our pelvis and help stabilize the pelvis on the back side of the body. So they're really important to strengthen also to help improve loading across the pelvis and reduce excessive force at the pubic bone. Last one here, inhale to prepare, exhale. Inhale to lower it back down. We're gonna switch sides. I'm gonna take that weight in my other hand, Set my body back up. Keep that hug around the yoga block. Inhale to prepare, exhale. As I pull, inhale to release. Inhale at the bottom, exhale, hug baby, wrap those two front hip bones. Feel that zip of your abdominals and pelvic floor upward as you exhale. Inhale to release. Once again, check in that your body isn't shifting side to side. It should stay fixed in the exact same position as it is when the weight is on the floor. Really use that core connection in your lats to draw that arm up to reduce any shifting side to side. Once again, we inhale to prepare, really focus on that expansion through the whole rib cage. Exhale to pull. Inhale again, exhale. One more here. Inhale to prepare, exhale. Inhale to release. Our last movement is going to be a squat. So I'm going to use this bench here. Feel free to use a chair that you have at home and bring your block or your ball or towel roll that you've been using. From here, I'm going to use that slightly more narrow position with my block just because I find that more comfortable. But again, feel free to use whatever width works best for your body. I'm going to sit at the edge of my chair. And what I want you to really focus on again is that hug into the block. With that hug, about 50% effort, we're then going to work on our hinge forward. And I often recommend then placing your hands out in front. Keep that hug around the block and then check in with your feet. If your feet are too far in front of your knees, it's going to be really hard to get up off of the chair. You're going to want to bring those feet back a bit underneath you so that your lift off will be easier. So we inhale here, exhale, hug baby. As you stand up tall, then we're going to inhale here, exhale, hug around baby as you hinge back and control your descent back to the chair. So again, we inhale to prepare, exhale. Press through both feet, maintaining equal weight through the tripods of your feet. Inhaling at the top, exhale. Sit back for that chair behind you. Torso is leaning forward on that 45-degree angle until you reach the chair to come back. So keep going here. Inhale to prepare, exhale, hug baby, press up. Inhale here at the top, exhale, hug baby as you slowly control your descent back down to the mat, or rather the chair. Inhale here, exhale. Inhale at the top, exhale. One last time, inhale here, exhale. Inhale at the top, exhale. To bring it back down. So I recommend exploring this series of exercises every other day as you're overcoming pain around your pubic bone. That way you'll be able to better know kind of what exercises are helping you and how your pain is feeling in between those days. And I often find that doing this series in that way for about 2 or so weeks often significantly reduces these symptoms. But if that isn't changing for you, then I highly recommend connecting with a pelvic floor physical therapist near you to help better figure out what your body is needing. And that way you can overcome your pain with your pubic bone and have more comfort throughout the rest of your pregnancy. So feel free to let me know in the comments below what additional questions you have about pubic symphysis pain or lightning crotch symptoms. And also if you found any of these exercises to be particularly helpful for you, I'd love to know that in the comments as well. So thanks for joining me today, and I look forward to seeing you in the next video.